Welcome everyone. My name is Tracy Curtis, and I am the chair of the board of Bracelet of Hope, as well as a proud Rotarian in Guelph, Ontario. We would like to welcome you here this evening. This is actually our fourth seminar, which is incredible. It started out as a fundraiser for Bracelet of Hope, right in the back of when we were just starting with this COVID craziness. And it has quickly become an event that we all need just to hear a safe place, to hear answers, to share questions. And we're so grateful that you're joining us here tonight. So Bracelet of Hope actually started over 10 years ago. Anne-Marie Zajdlik is the founder of Bracelet of Hope. And Bracelet of Hope started by our goal is to eliminate HIV in Lesotho, Africa. So in Lesotho, there is still 1 in 4 are passing away of HIV/AIDS. And so because of that, there are over 200,000 orphans. So we have 6 foster homes in Lesotho where we care for about 46 children at the moment. But in March of this year, fellow board member and I, Gord Riddle, were in Lesotho and we launched a mobile health unit. So that was to take HIV medication, actually, and to test and to treat HIV to people that were not able to get to clinics. The most incredible thing about that is I spoke to Dr. Josephine, is our physician of our partner in Lesotho with Solidaire Med. And I spoke to her this week and I asked her about vaccinations. So vaccinations are all in our mind. We're hearing about it. It's all we hear all day long. And imagine the people in Africa dealing with our same COVID situations. Their children are home from school and wondering, when am I going to be able to get a vaccine? They don't even have HIV medication there accessible to them. And she basically laughed. She is in the role of, just as Linda Hasenfratz is in Lesotho, so she's on the task force there. So thank you for joining us tonight. This is a fundraiser for Bracelet of Hope. If you are able, you can go to our website. You can find out a little bit more about us and follow along on our journey or like our Facebook page. But thank you so much for joining us tonight. I have the pleasure to introduce you to my dear friend and fellow Rotarian, Marva. Marva Wisdom is a senior fellow at the Monk School of Global Affairs and Public Policy at the University of Toronto. A senior equity and leadership practitioner, she is the City of Guelph's external lead consultant towards eliminating systemic racism. Marva is the director of Mutageti's Foundation of International Arts Everywhere Festival and is a proud Rotarian along with Anne-Marie, and a co-authored the newly released book, Collecting Courage, Joy, Pain, Freedom, and Love. So Marva, you're going to be our moderator for this evening. So thank you so much. Everybody here, I want everybody to know that volunteers their time. So everybody's worked a long day. And so we were all volunteers just getting you information out. And Marva, thank you so much for volunteering your time and helping deliver this wonderful conversation.
Thank you, Tracy. Thank you so much. Hard to say no to you. It was going to be a one-off in June, but these incredible women and our guests, it's just been marvelous for our community. So it really is my pleasure to be able to be here and be a part of this and be a part of really supporting our community in a different kind of way. And for all of you who've been tuning in every month, we welcome you. We're so delighted that you are tuning in. I hope that you've invited a few friends, because the information that you hear here, the opportunity to have your questions answered, I think it really is terrific. And I'm telling other communities that we're doing this. So who knows, other communities might start doing that as well. Each month, Anne-Marie and Helen will be the 2 panelists answering your questions about the mental and physical implications of COVID-19 pandemic. Anne-Marie Zajdlik is a primary care physician in Guelph. She provides comfort and guidance to thousands during the pandemic. And Anne-Marie's become quite a Facebook sensation with her daily posts of encouragement and sound scientific knowledge about COVID-19 and other health issues. And our other regular panelist is Helen Fishburn. And Helen is the executive director of the Canadian Mental Health Association of Waterloo, Wellington. Helen is a lifelong advocate for increased awareness of mental health issues and has dedicated her career to advancing the design of an improved mental health care system. And certainly during COVID-19, Helen is in more demand than ever. Her and her team are doing incredible work for our community and beyond. And so we thank her for the work that she is doing. And we are really, really, really delighted and fortunate, I'm going to say, and really honored to have our guest here tonight. We've had some fantastic guests, and joining us is Linda Hasenfratz, President and Chairman and CEO of Linamar Corporation here in Guelph. Linda has a very distinguished career as one of Canada's top corporate leaders, and I'm going to say one of the world's top corporate leaders, because word gets around, Linda, I have to tell you. However, tonight she joins us as one of 9 people in the government of Ontario that has been appointed, for the government of Ontario, that has been appointed to the COVID-19 panel to ensure effective and ethical delivery of a vaccine to Ontarians. And so, Linda, thank you and welcome. We're so excited that you took time out of your schedule to join us here today. So a few housekeeping rules as we go forward. We want to make sure that we're going to try to answer as many questions as possible. Tonight, you could be joining us either by Zoom, webinar, this link, or via your Facebook Live broadcast. We are ready to receive your questions on either platform. So we ask you to feel free to type your questions into the Q&A section of either Zoom or Facebook, and we will do our best to answer all of your questions tonight. We are recording this webinar, and it will be posted on CMHA Waterloo Wellington webpage and on the Bracelet of Hope and Anne-Marie Zajdlik's Facebook pages after the webinar is over. So the questions we don't get to, we'll try to answer them on some of these platforms that I just spoke about a few minutes ago. Now we have until 8:15. We have a hard stop at 8:15. And we're going to apologize ahead of time. Last time we had a ton of questions. We answered as many as we could. Sometimes it's rapid fire. Other times it takes a little bit of time for us to make sure that we're covering everything for you. So we are here to support you and love to now get on with the discussion. And so I'm going to pose to our 3 panelists and I'm going to ask them if they could just open with some words of advice, some comments that they want to share before we get into the question. What piece of information is sort of burning that you think that the viewers need to know? And I'm going to ask Helen to go first, followed by Anne-Marie, and then Linda.
Thanks, Marvin. It's wonderful to be with everybody tonight. It's been a rough 10 months, and here's the truth. We're in the toughest part of the race right now. We've seen a resurgence of COVID cases, positive cases in both Waterloo region and Guelph Wellington. We're in the winter months, and we've got a very difficult and different holiday season around the corner. So there's a lot of folks suffering right now with the losses and the stress of the ongoing pandemic. Even though we've got some amazing hope on the horizon with the vaccines, which we're going to talk about tonight, we know that they need to roll out across our community, and they're not here at this very moment. We've got some time between now and when the vaccine arrives. We need to get through the next few months, and we need to help each other through that time. I've been describing our journey through COVID like a marathon with no finish line. And I am really hopeful that tonight we have a glimpse of a finish line. Even though the finish line isn't right there, we still have a ways to go to reach the finish line. We can definitely see it for the first time in 10 months. And we can't all cross that finish line together. It's not something that we can all cross at the same time. So we're going to have to pace ourselves, and we're going to help each other over the finish line as we get through this. You've seen those marathon runners at the end of the race kind of hobbling across the finish line and helping each other across. That's kind of what the pandemic feels like right now. And we know that the mental health part of this race plays a huge part, definitely over the next few months as we look to the finish line. We're really going to need to help each other, and we're really going to need to find the strength within ourselves and with some additional supports to get across that line. So that's what we're going to talk about tonight. We're going to talk about the vaccines. We're going to talk about what we need to do to stay mentally well. And we're going to talk about what the resources are that we can get across that finish line together.
Thank you, Helen. And Marie? Oh, I think you're muted.
No, I'm not muted.
Now you're not. You're good now.
Good. Thanks,
But
Helen.
you might have to the volume a little bit if you can, or maybe lean in closer to the mic.
Yeah. I'm just going to echo what Helen has said. I don't want to repeat it because I want there to be lots of time for questions. I just had a really rough weekend emotionally, and it was a long haul. Well, weekends are long and they're dark and they're lonely. And we have a really tough weekend coming up with Christmas around the corner. It's really hard to imagine that this is going to end. And it may be hard for some people to be inspired by vaccines today. But we really need to persist. We need to remain strong. The light, as Helen said, is at the end of the tunnel. And I just want to encourage everybody to get a vaccine and get through Christmas without gathering.
Thanks, Anne-Marie. I think Allison, thank you, Allison, for your coordination. She's probably upped your mic a little bit because I know that folks are really going to want to hear what we're all saying. And over to Linda, our special guest.
Thanks so much, Marva. It's a real pleasure to be here this evening. First, I have to admit, I'm not president or chairman. I just have to put that out there because our president, Jim, and our chairman, my father, would be really unhappy to think that I was trying to take their jobs away. So just CEO.
Just CEO.
Just CEO. Thank God I've got those two fellows that we all work so well together. So it's a real pleasure for me to be here and talk about what I see as a really important turning point in the pandemic. So, as you've just heard, we've been in this for 10 months. Realistically, we've got another 4 or 5 months of tough times ahead. So it's not going to be easy. But I truly believe we're at the beginning of the end. And, if we've got 10 months in, we've got another 4 to 5 to go, that means we're 2/3 through this. And I just feel, that makes me feel really good to be able to say that we're 2/3 through this. So we've gotten this far and we can get to the finish line, just as Helen and Anne-Marie have said. So I wanted to be here tonight to talk a little bit about the importance of all of us stepping up to get the vaccine when it's made available to us. So I think there's just a lot of misinformation out there about the vaccine, worries about whether it's safe or not, worries about how quickly it was developed, and does that mean that it's safe, and were corners cut in the development or in the approval of the vaccine, and so I wanted to be able to talk a little bit about that and assure you that no steps were skipped in the development of the vaccine. No steps were skipped in the approval of the vaccine by Health Canada. And it really is just critical for the vast majority of us to get the vaccine in order for us to achieve the herd immunity that we need in order for us to go back to a normal existence. So in terms of the facts that I wanted to share, I would say a few things really just specifically around why I think that the vaccine is safe and why, yes, it was fast that it was developed, but why that is. So really 4 key reasons why they were able to develop this vaccine as quickly as they did. So number one, the Pfizer and Moderna vaccines use a different technology to what traditional vaccines have employed. It's different, but it's not new. So that's really important. It isn't a brand new technology. The technology was actually developed years ago and has been refined over years to be, really used really effectively and safely. So it uses messenger RNA to essentially deliver a message using genetic code into the cells to allow them to combat the virus. That's kind of it's probably not the best scientific explanation, but it's an easy way to think about it. And that messenger technology had already been developed and tested. So that's not new. So to use it, you basically have to have the genetic sequence of the virus that you're targeting, which actually isn't that hard to get, and then use it to kind of code the mRNA. And that takes a lot less time than the methods that were traditionally used to develop other types of vaccines, which did take a lot longer. So number one reason was different technology, so they were able to do it a lot faster. Number two, scientists were already familiar with the basic sequence of coronaviruses and how they work, because they worked with coronaviruses in the past, like SARS, for example. So that gave them a head start on how to develop this vaccine. Number three, normally drug approvals take a long time, right? We hear all kinds of stories about how long it takes pharma companies to get their drugs approved, and that's because there's a big pile of drug approvals to go through, and when they get to that particular agency, they go to the bottom of the pile and eventually they make their way to the top, and that can take months. But given the urgency, obviously, of the situation, these vaccines went right to the top of the pile every time an approval was required, and that really helped to expedite the process as well. And then finally, given the urgency of the situation, drug companies and Pfizer and BioNTech are a great example, collaborated with each other, right? So these are two different pharma companies. They collaborated with each other. They shared their knowledge and the work that they've done to sort of dramatically accelerate the time frame to develop technologies. And we all know that collaboration is sort of a time-tested way to get answers faster. Two heads are faster than one. So really, for all those four reasons are good reasons why you shouldn't be worried that, gee, this was developed really fast and that somehow corners were cut. Corners were cut either in the development or in the approval.
I think you're on mute, Marva.
That I shouldn't put myself on mute. I know that later on we're going to have a poll to talk about how people feel about vaccines. So Linda, you've given people a lot of information to think about. And I think the last poll we had about 80-something% of people that said that they are going to, they're okay to get the vaccine. And so hopefully after that message, we'll be higher up. We want to get to 100%. And Anne-Marie always says that we want to get to 100%. So let me just start with one question that is here right now that we just want to share. And this is about Christmas. A lot of people are thinking about Christmas right now. I'm thinking I need to get my Christmas tree up. There are folks that are thinking about family members and how they celebrate. Susan asked the question, who is safe to celebrate with and who isn't? If we can't see people outside our immediate household, how can we celebrate together? I know that is really a very strange kind of question. Maybe I'll go to Anne-Marie first and then make the rounds.
So with Guelph being in the red zone now.
And so I'm going to ask Anne-Marie to speak up a little bit.
With Guelph being in the red zone now and other areas being in lockdown, you really can't gather with anyone outside of your household. I think the indoor gathering limit now is 5 in Guelph of total of people that are that gather in a household. And if people gather in your household that are not part of your bubble, they have to wear a mask and stay 6 feet away from you. Christmas is going to be very difficult. There is no way around it. But we must avoid gathering in large groups or with anyone outside of our household bubble, and follow the strict public health guidelines, regional public health guidelines, because it really depends on which color zone you're in. Or we're in horrible trouble by January or February with a soaring case count, increasing R value and huge increase in the number of deaths. It will make the final 3 or 4 months until we're all have access to the vaccine extremely difficult if we're not careful at Christmas time.
Thank you, Anne-Marie. I have a question, and this next question is probably for folks who have teenagers or pretty close to it. It's about best practices. What are some best practices, and how are people actually managing the following scenario? Teenagers dating, different households, outside of the bubble. How are people managing that? And exposure because of intimacy. How should they, what are the better practices for that? Who wants to take that one?
Helen should take that one.
Okay.
Yeah, I think this is a really tough one, right? Because what we know, especially with young people, is pretty well everything that matters to them at that age and stage of their life is their networks. And it isn't being at home with their mom and dad and their grandparents. As much as they love their parents and their grandparents, that's not where they want to be. So I think it's really important to have those conversations and to have those conversations with other families that you're connected to as well. There might be ways to negotiate how you can safely visit and still have youth be able to be connected. But again, as Anne Maria said, it's vitally important that we remain in households and that those bubbles are not mixing. So those are conversations that you need to have. You need to sit down, you need to be planful, and you need to talk about alternate ways for youth to be able to stay in touch with each other, to stay virtually connected. I mean, thank God we have things like Zoom, FaceTime, all of those methods, right? We also know that this is a temporary problem. It's not going to last forever, but it is really hard, particularly for youth, and that needs to be talked about and acknowledged and really worked through. But it's really about, the focus is about keeping people safe, especially, you know, people in your own household. If you're connected to parents, grandparents, all of those, it's a ripple effect.
Okay, thank you for answering that question. Thank you, Helen. Someone is asking about educators who are currently walking into schools where they're now finding 30 plus positive cases via asymptomatic testing. They're being asked to supervise 30 students in a class at lunch indoors while they're not wearing a mask and in close proximity. This is the person's position. And the person says, is my observation correct that educators are nowhere to be found on the province's vaccination priority list? Can you comment on that, Linda? I know there's certain things that you can't comment on, but there are other things that you might be able to.
Yeah, sure, absolutely. So it's not true that they're not on the list to be vaccinated, but they have what the government has tried to do is identify who the highest risk and the most vulnerable people are and try to get those people vaccinated first. So for instance, phase 1 is going to focus on long-term care homes, both the residents and the caregivers and staff. It's going to focus on healthcare workers. It's focusing on Indigenous people and adult recipients of chronic home health care. So those 4 groups are sort of the most vulnerable, and then they'll layer onto that where are the highest risk areas. So obviously the gray and red zones are going to be the highest risk. So it'll be the intersection of those two who will be getting the vaccine first. Then it'll expand out to other older people, so people over 80 and then people over 70. So again, the whole priority is around who's the most vulnerable. And then once we get past that group, then we'll be open to the general population. So that would include those teachers and all the other people working in all kinds of other situations where they're exposed to large numbers of people. So prioritization within that much larger group is something that's still being developed. So where the teachers will land in there, it's not entirely clear as yet. Top focus was those really vulnerable groups that I described, which will be the focus over the next couple of months.
Okay, great. Thank you. Thank you, Linda. This next question is for Anne-Marie. Anne-Marie, this person says they carry an EpiPen. And should they wait for later vaccines? Pfizer seems to have suggested not to have their vaccine. Do you know enough about that?
So
or no?
I don't think Pfizer, correct me if I'm wrong, has recommended against that.
I think I'm having trouble hearing you again, Anne-Marie. I'm not sure why.
I don't think Pfizer has recommended against that. I think what's happened is the initial rollout in the UK, 2 people with allergic reactions were identified. They're both recovering well, and both of them had multiple, although unspecified allergies. And many people in the medical and scientific community believe that that the United Kingdom should not have announced that reaction and created such fear and panic, because there are usually far more allergic reactions to standard vaccines that have been around for decades. And without specifying what these people were allergic to, it makes us too concerned. So if you carry an EpiPen for a specified allergy, you are still safe to get this vaccine. We have a good 3 or 4 months to wait before the general population will be immunized. And so we'll get more information about who might be allergic to the COVID-19 vaccine, but the products in the vaccine, the ingredients, are not allergenic type of ingredients. So my guess is there will not be significant allergic reactions, and that people with allergies right now will not have a problem with the vaccine.
I'm so glad that this came up, because this is something that I've come up on several times in the last week. Somebody actually last weekend said to me, "Oh, if you've got allergies, you can't take the vaccine." It was like, oh my gosh, like it's nothing like that. I mean, if you have a severe allergy to one of the ingredients that's in it, then of course, and that's obviously what the case was in the situation in the UK, but somehow that's been extrapolated into this idea that if you have allergies, you can't take the vaccine, which of course only is true if you have an allergy to one of the ingredients. And actually Health Canada put out a release over the weekend that listed all of the very specific medicinal and non-medicinal ingredients that are in the Pfizer vaccine. So if you do have a serious allergy, you would obviously know to what, and you can simply reference what's in there and see if any of those things are an issue.
Also, if you look on a recent Facebook post, I've put down what the actual ingredients of the vaccine are. And I just don't think any of them can cause a significant allergy, but have a good read, because it's well publicized now what is in the vaccine besides the messenger RNA.
Thank you. Thank you both so much. Someone asked, what in the world is herd immunity?
Okay,
I think that's a really good question.
So there comes a point, usually at 70%. If 70% of the population is immunized, then the R value, or the reproductive value of a virus, its ability to spread to other people, drops way below 1. And when it drops below 1, if you as an infected person can only transmit to 0.5 people, then in no time at all, the virus is no longer in your community. So 70% is the number of people who need to be immunized before the virus is no longer being spread in the community. You might have outbreaks here and there, but there won't be community spread, and we can let go of our restrictions and get back to a normal life.
Thank you. Herd immunity, you heard it here. Sorry, I had to say that. Helen, can you catch COVID if both parties are wearing a mask, or do you have to be 6 feet apart also?
I'll get
definitely.
that. Yes, you can still.
Yes.
The distance is fine, but you should still have a mask on. I recently had a patient in my practice who was very innocently walking with a friend a couple of weeks ago, and they were outside. You don't have to wear a mask, right, when you're outside, but they a couple of times breached the 6-foot rule, which is so easy to do when you're walking with a friend who you're used to hugging and holding and being close to, and COVID was transmitted. So this is a sneaky virus. It is so transmissible. So if you are with someone who is not from your household bubble, stay 6 feet apart and wear a mask.
Okay, that's solid. Did you want to add something to that, Helen?
No, I think that's a great answer.
Okay, fantastic. What will be the best source of information about how to get vaccinated once it becomes available to the general public? Linda?
Sorry, could you repeat that?
What will be the best source of information about how to get vaccinated once it becomes available to the general public?
So both the federal government and then each province is approaching their rollout differently. So my suggestion would be to reference the Ontario website that is already detailing all kinds of information and frequently asked questions around the rollout. So when, to who, etc. So as you mentioned, or somebody mentioned, the rollout to sort of the general public is coming in sort of April timeframe. So how you go about getting signed up for that vaccine is something that is still being finalized by the government. So as an example, in other countries, like in Europe, for instance, they have data portals where you go in and put in your information, and then you get automatically slotted into the right time frame, right? So just because you got in early and put your name in early doesn't mean you're going to be at the front of the line. You'll go in at the right time for your sort of risk level. But it's a way that they can then track where you're at. So, you know, that's an example of what some other countries are using and what is being evaluated here. So more information to come on how to get yourself registered. The first phase of vaccines, obviously, given the groups that I described, they will be able to identify those individuals through the public health units and through, you know, the long-term care facilities and the hospitals, et cetera, because that's, you know, all those people are well known who need to get vaccinated, and it will follow the recommendations of the public health units.
Okay, great.
I think I would just add to that how important it is, Linda referenced this, is making sure you are looking up reputable websites, reputable information. There are all kinds of information that's popped up. People have created their own websites, and sometimes, you know, their intentions are good, but they're unknowingly sharing misinformation. So make sure that that information comes directly from the source, and local public health units are also great ways to make sure that we understand fully what's happening.
And Marie's pretty good in terms of her Facebook and what she posts, really succinct information as well, that you can add. If you're a Facebook person and you're on Facebook all the time, that might be a good place to go. As Helen, as you responded to that question, I want to follow up with what are some of the lasting effects on mental health from being isolated for so long? What have you been seeing?
Well, it's been really tough on people's mental health. We know that. It's been like we've never been here before, right? And there were certainly people that struggled before the pandemic, but what we've seen now is that people are extremely anxious and depressed because of the isolation. There's lots of people that have been lonely, not everyone, but we've seen also remarkable resilience as well. The other thing that we've seen, Marva, through the pandemic, sadly, is that domestic violence has increased. We know that the factors around domestic violence are actually amplified around a pandemic, and that is isolation feeds domestic violence, as well as people not feeling any sense of control, and the victim of domestic violence not having those networks of support, which has really been hampered by the pandemic, as well as substance use and abuse and people losing jobs. All of those are really important factors as to why domestic violence increases. We also know that certainly some groups struggle through the pandemic more than others, and those are folks who have a lower income, who have chronic health conditions, and who have had long-standing mental health and addiction issues. The pandemic makes their situation that much more challenging. The other group that we watch are folks who have been compounded by racism. We know that systemic racism and inequities and injustices also lead to more suffering, and they're more vulnerable through the pandemic as well. So we have certainly seen that. Certainly the folks that have reached out to us are many of the folks that have struggled in isolation for all of those reasons. I will tell you that we've really increased our support to the community through the pandemic, both through virtual and online counseling and groups, webinars, but also our system has really stepped up and provided more face-to-face care as well. So help is there. We have to really build that bridge for folks that are feeling that loneliness and isolation. And sometimes I would say that we need to reach in, not just wait for them to reach out as well.
Thank you, Helen. And I might add to what you just said about systemic racism. It's almost like another pandemic because it's been around for a very, very long time without a solution. A recent article in The Guardian, and it's an article that cited a study, a 25-year study in the United States. It's a longitudinal study that followed 800 Black people from the time they're 5 years old. And it came out with the life expectancy of these individuals, many of them are 30 and plus going forward, is lower. And it's a longitudinal study, and they're looking at, so the mental health implications for
Yes.
folks who are dealing with systemic racism is the layering
Yes.
aspect, right? The layering that allows you to be even more vulnerable than normal. And of course, most of the time, some of these folks are on front lines or otherwise, and some of these folks have underlying issues, not just mental health, but physical health.
That's
And
right.
because of all of that, the pandemic has hit them that much harder. And many don't have the luxury of being able to stay at home or to work from home. They have to go out to work. And that makes it very, very challenging. I have a specific question for Linda. Speaking of going out to work, how has the pandemic impacted Linamar, Linda?
Yeah, so I mean, obviously, huge impact back in the spring when we, like everybody else, were shut down for 2 long months. Our customers were all shut down, and so we were shut down too. So that was a very, very tough time. We had a huge percentage of our employee base laid off. Everybody who wasn't laid off was working from home. Happily, since then, things have been coming back really well. So we've been back to work since mid-May. And I'm really proud to say that we now have 97% of our workforce back to work. And 97% of those people are physically back at work, so in the office and in the plants, and has been since that sort of May, June timeframe. So the good news is that the safety protocols that we've put in place are working, right? So, you know, we interview people coming in, we take temperature of everyone coming in, we have maintained 6-foot distance, or we've put partitions up where people were working too closely together, whether it was in the office or on the shop floor. We enforce the use of masks and provide them, obviously, as well as gloves. So, you know, that providing that safety equipment, that PPE to keep people safe. And the good news is it's working, right? So, I mean, yes, we're seeing positive cases pop up from our plants around the world every week. But what's clear is that it's coming from outside of the facility. So they're catching it, you know, in the community, at home, in some of those gatherings that were referenced earlier. And what we're not seeing is transmission within the facility. So that makes me feel really good, because our goal was, when we brought our people back to work, that we wanted them to be as safe or safer at work than not at work. I actually feel like they might be a little bit safer at work, because at work I can enforce the utilization of the masks and the distance and the protocols and the cleaning and all the rest of it, and make sure that people are being kept safe.
It's good what Linamar is doing and the experiences that you're having. And I'm going to check in with Henry as well. What are you seeing around the rest of the community, Henry, in terms of folks and COVID-19, and how, what is the transmission, what does that look like around our community now that we're in the red, especially?
What is the main mode of transmission?
Yeah.
Okay, so the 2 main modes of transmission.
I'm going to ask you to speak up louder again. Sorry.
Way up top, no one ever says I'm quiet. No one ever says that. So way up on top of the list is social gathering. It's gathering with people outside your bubble, and it can be as innocent as walking with a friend outside, right? As innocent as that. So it's definitely social gathering with people outside your bubble without wearing a mask or keeping your distance. Next is outbreaks that are happening off and on. Big one recently at Cargill, right? That increases our numbers. And then third is in the workplace, but it is in workplaces where social distancing and mask wearing is not enforced enough, or people are going to common areas and lunchrooms and getting too close together. A reminder that many workplaces will have treats for you to enjoy during Christmas time that are brought in and baked at home and brought in. Don't do it this year. Don't share it. Don't put your hand into anything that someone else may be grabbing food from. Say no. Bring the whole thing home with just one person taking it. But that is considered to be a risky transmission or a risky situation where transmission might occur as well.
Thank you. Thank you, Anne-Marie. I have a question from folks who are concerned about, they've heard reports about people with developmental disability being a priority for receiving the vaccine. They haven't heard reports that it's a priority, even though they're a very vulnerable population. Any idea if they're being discussed and considered?
Yeah, so I mean, the most vulnerable are the groups that I've identified. So once you get beyond that sort of over 70 year, then we've got, you know, that whole spectrum of the population that needs to now be prioritized. So I am sure that developmentally challenged people, that, you know, depending on where your work is and all of those kind of questions are ones that are going to be addressed in terms of prioritizing the rest of the population. Those discussions are still ongoing. So obviously the priority right now is where do we focus over the next few months. So that's where the team is really very focused. And then we have a little bit of time in order to be able to start working through those priorities.
I would just add, Marva, that folks with developmental disabilities who are living in group homes, so in congregate settings, definitely at our local tables are being prioritized for sure when the rollout happens.
Thank you for that. And following up to that, Helen, when do we expect that young children can be vaccinated between you and I guess this is probably one of those specific things that Linda had said, more information is coming as we go forward. Has there been conversations about whether it's safer for young children as they go forward? This person is concerned about their grandchildren, especially their grandson who arrived 3 months early and has very limited development of his lungs.
I'll defer that to Anne-Marie. She'll
yes,
know
Anne-Marie
more than I will about
yeah.
that.
What's the question?
The question is, when do we expect that young children can be vaccinated? And I know that it's not in the first group as per the information from Linda and others. Is it safe for them? This person is concerned because their grandson arrived 3 months early and has very limited development lung capacity.
Okay, so children are just now being studied with these vaccines. The studies of the vaccines in children under the age of 16 has just started. These vaccines were ready in February. That's how ready we were for this technology. We needed the time and the place and the virus, and here it is. They were ready to go in February, but it took 9 months to get them through some very important phases of development. They're through those phases. These are very healthy, very safe vaccines, but it has only been studied in adults. So the research into children is starting now. It will be 9 months before we can see that it's safe in children. Children are not the same as adults. And so I don't think it will be until next fall that children will be immunized or the vaccine will be available to them.
Okay, thank you for that, Anne-Marie. Someone said, am I immune from COVID as soon as I've received 2 vaccines?
No, you're not. Sorry, I'm jumping in on this one. And the reason is that it takes time for your body to develop those very important antibodies to COVID-19. When someone's traveling, for example, and they get their travel immunizations, don't even bother getting them if you don't have them 1 month before you travel. So it takes 2 to 4 weeks for the average person to develop a sufficient amount of antibodies, which means 2 to 4 weeks from the second vaccine. The first for Pfizer is day 1. The second for Pfizer is 21 days later. And then you've got to wait 2 to 4 weeks before you're immune. Thank
you, Anne-Marie. I know someone has asked a question about that we're talking a fair bit about vaccines. And so we usually go where the questions take us. So the folks who are calling in, the questions that they're asking is very much, this vaccine is very exciting for a lot of people. And so they're wanting to know newer information. And that's one of the reasons why we're very glad that Linda is here to be able to provide some of that information along with our other professionals here. So I just wanted to let you know, November, we talked a lot about preparing for Christmas, and we still want to talk about preparing for Christmas. There are a couple of questions. I'm going to throw them out at you, Helen. And the question is, my children want to come home from university for Christmas. How do I connect and spend time with them? And that was a similar question I remember Anne-Marie talking about with your son, and you were in the garage. I think you were in the garage while you're visiting with your son, just to make sure. And before you answer that, hold on to that, Helen, for a moment. We have a poll. It's a holiday question. How are you feeling about the holidays this year? And it's a multiple choice. Not good. I'm going to miss all the traditions and being with my family, or man, it's not great, but it's what it is what it is. And then I'm good. It actually reduces my stress. And so we're going to answer this question, and then we're going to go back to the end of the poll, the results of the poll.
Anne-Marie, maybe I'll let you answer the physical part, and then I'll speak to the mental health part.
So the physical part of which question, Marva?
And this is about your children coming home from university.
Right. Yeah, okay. So this is a really dicey, very dicey question. If you bring your children, if you allow your adult children from university to come into your bubble over Christmas, then you are breaching a public health guideline by blending bubbles and bringing people in who are not part of your household bubble. Again, you tell people what the rules are, what the recommendations are, and then you give them advice if you know or they believe they're going to have their kids home anyway. Here's how to do it safely, but I'm not saying it's okay. It's very, very dangerous, right? It's extremely risky. But if you are doing it anyway, make that child, adult child, wear a mask. And it has to be a very high quality, at least 2 layers of high quality cotton with a polypropylene layer inside, or better yet, a KN95 mask. The KN95s are the Asian equivalent of N95s, and they aren't being used by the healthcare workers in Canada. So if you can find a KN95, that's a good idea. But they have to have that mask on all the time when they're around you, and they should be 6 feet away from you at all times, which means not at the same dinner table when you're eating dinner, and not all around the Christmas tree opening presents. And you think of an innovative way to get those gifts opened without having one person hand them to another. Have hand sanitizer available if you have to do that, and clean like mad. Or what I would recommend that people do is put all the gifts sort of in one place the night before. And everybody's 6 feet apart. Please, not too many people, and don't do this if you absolutely, it's just not a good idea. But put them out the day before so that you're not handing gifts one to the other, and stay 6 feet apart. It's nasty. I hate this. I hate COVID. This is nasty. But we have to get through this Christmas, and we have to get through it without people dying. And you know what? I don't want COVID. The serious complications, the serious risks of this, if you don't pass away, you do not want these long-term complications. You do not want them. They are nasty. So stay apart and wear a mask. I ranted, didn't I? I ranted.
Yes, and before Helen goes, we have the poll here. Not good, 22%. And this is, the question again was, how are you feeling about the holidays this year? It's not great, but it is what it is, 61%. And I'm good. It actually reduces my usual stress. So if we look at about 79% of people are feeling that they need to be accepting of this, but we really need to worry and provide support for the 22% who are really, really struggling with missing family traditions, because a temptation will be there to do it, right? To get under that Christmas tree and fight for the gift or whatever it might be. Helen?
Yeah, I think the clinical term for this is COVID sucks. Like, it just is.
Like that.
That's the reality. It really sucks. And this is a great example. Now, I will also say, like Anne-Marie, real life is happening here. And we know that some of the realities is that some of our young people out there who are away at college, at university, or a work experience actually need to come home for their own mental health.
Yes.
And being at home and having your family together is really important. And it might be that they're actually more at risk if they're not at home.
Mhm.
So Anne-Marie's advice is great advice. There are ways to still be respectful of the public health guidelines, to be creative, to be innovative, and to actually be grateful, despite the fact that COVID sucks. You can still be grateful of that time together, of ways that you can be innovative and keep your distance and keep everyone safe and protected, yet still be grateful and have perspective that you're together, you're in the same space,
Healthy.
you're still enjoying that.
Great.
Yeah.
Linda?
Marva, can I answer a question here, because I think it's an important one to clarify the sharing of food issue. Someone's asking a question. Okay, so I thought COVID-19 was not shared or not transmitted very easily from surfaces. We go to restaurants. We don't wash our groceries down when we go to the grocery store. The problem with a shared or a plate of cookies is, imagine someone coming into the kitchen at the workplace, and they take a cookie, but they just coughed into their hand because they were in the washroom and they took their mask off, and they have COVID-19, and now a respiratory droplet is on their fingertip. And then they go and they grab a cookie, but they touch another cookie as they pull that cookie out. And then someone 2 minutes later picks up that cookie, and as they're taking it into their mouth, they breathe in a droplet. It's just much more risky because it's not a controlled scenario, and it's a real risk. Don't do it.
So what do you do, Linda, if someone drops you off, cookies, all the wonderful baked goodies? Are we saying being careful of these baked goodies that people like to give at Christmas time, especially now that people are locked in? There are so many people that I know that never cooked or baked before, and suddenly this is one of the gifts that they're giving to people, because it's also easier than going out to the store and buying. What are your thoughts?
My thoughts?
Yes, Linda.
Yeah. Well, I mean, I think in the workplace, it's easy to manage because you can just say, look, we're not going to do that this year. So please don't bring those baked things in. I know you're doing it because you're trying to share with your friends and your coworkers, but it's not the year to do it. So I think we can manage that. And then, I mean, if you have neighbors dropping things off, I mean, it's a tough situation, right? You don't want to say, oh, it's like back away, but on the other hand, to Anne-Marie's point, it's a potential risk. I mean, I would defer a little bit to Anne-Marie. If somebody drops something off and you let it sit for a day or two, then would it potentially be safe, or do you think that's still a risk?
What Dr. Mercer said at our last webinar was, this was at a Zoom meeting last week, because doctors get a lot of gifts and a lot of food being dropped off, and I'm so missing it this year, but I think people already have the message in mind that it may not be safe to do so. It is safe to do so, so I'll just say, but when it comes into my office, I'm responsible for it, right? And so what I've told my staff is leave it covered. At the end of the day, we can hand it to one person to take home. They'll take home the whole plate, leave it sit out overnight, and you're perfectly fine. It's just the sharing of the same plate of cookies or treat that could be dangerous.
So we're assuming that the person who baked it is safe.
Yes, and you know what? If the person who baked it, if inadvertently they have COVID-19 and they spread it to the food, by the time it gets to your place of work, there's nothing being transmitted on that.
Okay, that's good to know.
And yeah, so that's not a very risky thing, I don't think.
So we've covered one part of Christmas. You can almost indulge or overindulge. Linda, do you have any information about if the vaccinations will be mandatory and what types of restrictions will be put on people who do not get vaccinated?
I mean, vaccinations are never mandatory. So, it's always going to be on a voluntary basis. With regards to will there be restrictions, I think that that's in many ways up to the different institutions. Like, for instance, like that's not something that is being necessarily government imposed, but certain establishments like theaters or somebody's going to a concert or a sporting event or whatever may very well ask, or travel may very well ask for proof of vaccination before allowing you in. That's not going to be government mandated, but it's entirely likely that might happen, that different establishments decide that they're going to do that.
Thank you for that. And I have a question for you, Helen. I had it right up here and then it sort of disappeared, but I'm going to find it. It's right here. What resources are in community for persons suffering from anxiety? And you've talked about that before, and I know that they could go to CMHA's website and see some information, but can you share for this person calling in on the line?
Sure. So we do have a website. It's called Here for Help. So here, the number 4 help.ca. And it lists all kinds of actually written resources that you can look at based on age and different groups like employers or farmers. We also have links to all kinds of virtual care options on our Here for Help website. Programs, for example, like Bounce Back, which is a virtual CBT program, so cognitive behavioral therapy program, which helps people who are goal-oriented work through feelings of anxiety, depression. We also have counseling that's available online. And of course, almost all of us who are working in mental health and addictions also have face-to-face care options available as well. Of course, all the public health guidelines remain. That doesn't change. We have some amazing partners in our system as well. Like here in Guelph, Wellington, we have family counseling and support services. Over in Waterloo region, we have Horizon and KW Counseling. They are also providing amazing counseling services. There's a sliding scale. There's EAP services through people's employers. There is a lot of support out there, Marva, and that's really, really important for people to know. But what is most important is that don't wait too long before accessing that support, right? When you think of your toothache, if you have a toothache and it starts to bother you, you don't wait for that toothache to become an abscess, right? Your toothache starts, you immediately pick up the phone and call your dentist and say, I need to come in and see you, I have a toothache. Do the same thing with your mental health.
Yes.
The longer you wait, the harder it is to treat and the more you suffer, and you don't need to suffer. We're here, we're available. We have tons of options available. So please be in touch and we can definitely help.
And lots of people are reaching out, especially with COVID-19 and now with Christmas coming up, or any whatever the holiday celebration this time of year. Whether you're celebrating Hanukkah or anything else, this is the time to reach out if you're struggling. I'm going to group these two vaccine questions. Do we know yet how a vaccine passport will be implemented? And the other is, will we have a choice between which vaccine we want to get? And the which seem to be way, way out in the future. But is there such a thing as a passport?
Well, it comes back to this question of proof of vaccination, which is, I think, what the question is referring to. So the proof of vaccination being your sort of passport to travel or to access different establishments that might want to only allow people who are immunized in. So how that will happen is actually, again, something that's still being finalized by the government groups. So there's different methodologies for that. One would be a piece of paper that would prove your vaccination. There's also digital ways that can be done. So some other countries are implementing digital trackers for vaccinations. So those options are being evaluated, and again, will be announced in coming weeks.
Okay, thank you. Any other comments regarding the vaccination? There. Linda, someone has a question for you, and I figured that because you talked about this, I'll do a follow-up. It's back to Linamar. The person says, while I understand you have great protection in place while people are actually working, how do you stop them from socializing at break time, lunchtime without the masks and distance?
Well, they're still socializing and taking their breaks on site. So within our lunchrooms, we have similarly created in, like some plants have put partitions up in between each seat in the lunchroom. Others have simply put X's on seats that you can't sit in order to create the spacing. We are also trying to create assigned seating in some facilities so that we know exactly who was where, so that we can better track, who may have been exposed to someone else in the event that somebody does test positive. So different strategies are being used in different facilities. So as long as they're on the grounds, we can still enforce our safety protocols, and absolutely do. Once they leave the workplace, it's obviously we can't control what they're doing, other than to obviously give them advice, just like what Anne-Marie's been talking about tonight.
That's great. Thank you. This is another question that's really super practical. And it's, can you describe how a well-fitting mask should feel? My husband wore a 2-layer mask with polypropylene filter. He says it can feel like his breath is under his eyes. And if he pinches the mask closed, he can't breathe through the filter. Are masks supposed to block all air from escaping out the sides? That's a really practical question. And in addition to that, oh, there you have one like that. And Anne-Marie's going to demonstrate for the person and how you put it on properly.
So this is a high quality 2-layer cotton mask. This is from Hand and Hides and Hand in Rockwood. And it has a pocket where you can slip in the polypropylene layer. I've had people drop off masks to me this past week where they have actually sewn in the polypropylene layer, so you don't have to put it in and remove it. If you get a mask like that, you can't put it in the washer and dryer because the polypropylene may not withstand the heat of the dryer. So that's if it's permanently fixed into the mask. So we do recommend 2 layers of good quality cotton and an inner layer of polypropylene, whether it's inserted or sewn into the mask. I made this mask fit by tying the ear ties a little bit tighter. So yes, if it's down here, it's no good because there's a lot of space where, see how when I talk, if I'm breathing out COVID, it's just shooting out here. If I laugh or sneeze when the mask is on like this, then I'm transmitting COVID. So it has to be snug around the nose and almost right between your eyes, okay? Not obstructing vision, but almost right between your eyes. If you can get a mask that has
sort of a bone,
yeah,
kind of
that can squeeze against your nose, even better, and squeeze it tight. It has to cover right to your ears, because if it's covering only to here, and you cough or sneeze, poof, out the droplets can go. But if it's back here, your droplets are stopped before they can exit, right? And then it can't be, sorry, like this, because again, when you talk, you may expose your mouth and cough out. So it really has to go well underneath the chin. And some people don't feel comfortable wearing masks. They do, and you take it off like this, right? And what I'm doing with mine now is I am taking it and leaving it at the kitchen sink at night, and I'm washing it in the hot soapy water of the kitchen sink, and then I'm hanging it to dry. I find that when I put them in the wash machine and the dryer, they shrink and they don't fit as well. So if I've got a really nicely fitting mask, here I'm putting it on, here I'm taking it off, then it goes into my sink. I leave it sit for 10 minutes or so. It's hand washing, 10 minutes or so, nice hot soapy water. Then I take it out, rinse it out. The polypropylene layer I do separately, and then I hang it to dry, ready for the next day. But it is uncomfortable for some people. There's no point in wearing it unless it fits this way.
Okay. So there's one, hopefully both of them are watching the demonstration, and the wife doesn't have to explain it to her husband how to do it right.
Yeah.
That will be a lot of fun. That's really good, because that's another question that people have. And sometimes people wear masks, the one-time use mask. There are people who wear them over and over again. And then there are others who wear the cloth mask and wear it for a long time before washing it. So you're suggesting that you should wash it after every wear, like every night.
Be safe. Yes. So the number of times I've gone up to my husband and ripped his mask off because it's filthy, because he's outside in the garden or he's doing whatever. As soon as it's soiled, it's easier for viruses to penetrate it. Okay, it's just lost its ability to filter if it's soiled. And I didn't grab a patient. I spoke to a patient today and gave him a new mask because there was a hole in it. So we've been wearing masks long enough that the ear pieces are wearing out. There's some holes coming in. So it has to be an intact, clean mask. And it's just safest to stick it like you wash your dishes at the end of every day, maybe not. Stick it into the hot soapy water and just clean it every day.
Did we find out where we got polypropylene? Last time I mentioned Lens Mill and someone said, no, it's not there.
Yeah, it's not easy to find.
Okay.
And so Lens Mill store had it once. Craft stores might have it. You can Google it on Amazon, and I hate to say that because I want everyone to buy local this year, but you can get polypropylene, the appropriate polypropylene purchased on Amazon, and it's not very expensive if you do that. Hides in Hand in Rockwood. If anyone has another place where they're selling masks with the polypropylene, you can also get the polypropylene in packages of 5 at Hide and Hands and Hides. Rockwood.
At where?
Hands in Hide or Hides in Hand in Rockwood.
Okay, that's great. Thank you. Next question for Helen. For anyone who's doing just okay, but no debilitating anxiety or depression, what are 2 or 3 daily self-care routines that correlate with better mental health outcomes, like phoning a friend or dancing or meditation, prayer, things along those lines?
Great question. So we all have resilience, right? And we've showed remarkable resilience through this pandemic. What I would say is that our resilience really dried up in about September. And because resilience is great for just regular life. We are not in regular life. So we can't just kind of resilience our way through this. What we actually need to do right now is add more skills, more specific tools in our tool belt, go to workshops, learn new things, build our informal system, and then build our formal system. And that adds on to our resilience. So our resilience never stops. We just don't have enough resilience to get through this pandemic. There's a couple things which are vital. First is daily exercise. So daily exercise, there's a ton of research, 30 to 45 minutes per day, a brisk walk, a quick run on a treadmill, whatever works for you. And again, everyone is very unique, but do something that gets your heart rate up. And definitely if you combine it with fresh air, that really helps. And the other thing is some mindfulness. Mindfulness calms our mind. It allows us to stay present. It allows us to keep perspective and to keep gratitude alive as well. That is so important right now. Everybody has their own way of practicing mindfulness. Some people like to do listening to visualization. Some people like to read quietly. Some people will, talk to someone or journal. Everybody has their own way, but find that technique that works for you, because calming your mind is so important right now, as well as exercising. And then, as I mentioned earlier, making sure you're reaching out and getting that support when you need it.
Great, thank you so much. We're at 8:10 and we're wrapping up at 8:15. I don't know where the time has gone. And Linda, someone had asked about who was getting the vaccine and ask for a repeat of that. But I think we're going to put it on the website because I think you mentioned it a couple of times over. Someone has asked though, is there somewhere the public can go to give feedback about which groups should receive the vaccine, not who the government has decided? There are other very vulnerable groups that have not been mentioned yet in regards to prioritization. So is the government getting information in, of from others, consultations around that question?
Yeah, I mean, I know that they're consulting with a wide variety of professionals and in the medical and other spaces as to what the right answers are to prioritize. I don't know the answer to the question. Is there a place that like anybody can go to just sort of put in some feedback, like a website or a chat. Not that I know of, but it's something I can investigate and maybe can get posted if there is such a place. I'm not aware of one right now. There is lots of information, however, that is posted on the Ontario website around the vaccine. So lots of information about the different groups that are being prioritized, how it's being rolled out, the number of doses, the different phases. All of that information is actually on the vaccine website, the Ontario vaccine website.
Thank you. And thank you, Helen. I haven't gone out walking and running. I have to say that, go back to that for a little while. And my body feels it. And I know that I need to do that. After about 2 weeks, it says mentally, you need to do this. And thank you, Linda, so much. I think before we wrap up, I'm just going to mention a couple of things. Someone said yoga and exercise, and ask for a closing, maybe 30 seconds, 45 seconds of closing words from you wonderful guests here. And someone said polypropylene, a triangle sewing on Woolwich Street.
Oh, nice. Thank you.
Amy says that is there. Amy Kuzno, my friend. Hello, Amy. That's wonderful. And someone asks about face shields. How do we feel about face shields? So I'm just taking 2 more questions.
So do you mean face shields in place of a mask? Probably the question. If you cannot wear a mask for whatever reason, and there are some people who can't, then a face shield is not as good, but it's better than nothing.
Okay, great. Someone is thanking you for the mask demonstration. So that's great. And I think we're going to have to wrap up there. We have questions that are unanswered, but we'll work to post some responses for you on Enry's Facebook, as well as CMHA's website, CMHA, WW, and of course, sponsor Bracelet of Hope. And Bracelet of Hope is there. And Emery, you spoke briefly about, the AIDS vaccine, and so did Tracy, and how difficult it's going to be for these groups in Lesotho and elsewhere to get this vaccine. And they're still working with trying to get the AIDS vaccine. And we also parallel this vaccine to polio. Polio is on the rise around the world right now because people have not had an opportunity to get their children vaccinated because of the restrictions of COVID-19. And polio is a debilitating disease, as you know, and was almost eradicated, came this close to eradicating it. And Rotary is at the forefront of that, of course. So lots of interplay here. We just recognize that we're one great big world. And on that note, I'm going to go the other way around now and ask Linda for a few closing comments, and then Henry, and then Helen.
Okay, I'll keep it very, very short. Again, I think we are at the beginning of the end, but only if we all step up to get vaccinated. A reminder that the vaccine is safe. We have ample supply of the vaccine coming to inoculate every Canadian that wants it. Please keep looking at the Ontario website. The team is trying to keep everyone just as informed as possible with all the answers that they can. So keep watching for information updates on who's getting the vaccine, where, when, and how, and just make sure that you and your loved ones get signed up just as soon as the information is released on how to do that. And a reminder, we need at least 70% of Canadians to get vaccinated to get back to a more normal life. So please step up and do so when your turn comes.
Thank you, Linda. Thank you for being here. Henry.
So Christmas is coming. It's going to be very tough. Think of different ways to celebrate. One thing that I'm thinking about doing is I do a lot of Christmas baking. I may just show up at the doorstep of close friends and leave a box of cookies and sing an off-tune Silent Night. So think of ways to share with one another and to be grateful and reach out to one. That's what Christmas is about. It's about loving and sharing and taking care of one another and really focusing on what's important. So that's what I would recommend. Stay tuned in my Facebook post because I am going to cover a lot more information in the next little bit about the vaccines. They are revolutionary. They're miraculous. It is time for these vaccines. Don't be afraid of them. Particularly, don't be afraid of allergies, because there's not likely any significant allergy to this vaccine. Stay tuned, we'll learn more, but don't worry about allergies.
Wonderful. I'm going to interrupt Helen for a moment because we had a poll that says, do you plan on getting the vaccine when it becomes available to you? Yes, I'm ready is at 88%. That has gone up. Not sure, still need more information is only 12%, and no way is only 1%. So Linda, there you go. That's great to take to your committee. And now over to Helen for the closing words. And everybody, before Helen finishes closing, have a wonderful holiday celebration and a safe holiday celebration. And thank you. We'll see you in January. Helen.
Well, I think the most important way to end our conversation tonight is to focus on hope. So
Yes.
hope is what we all need to hang on to. We know the finish line is coming. We need to get across it together. It's going to be really hard for some folks to be able to work through the next few months. We need to support each other for sure. Remember, self-care is so important. Everything works better when you unplug it, even people. So take the time to regenerate and also keep an eye out for folks that you're concerned about. We can practice gratitude with each other. We can definitely approach the holidays with a different set of expectations, but we can still enjoy with some planning and some positive thinking. We can still find some hope and peace over the holidays. So please take care of yourself and each other.
Wonderful. Thank you. Thank you, everybody.
Merry Christmas. Stay tuned for the next webinar.
Thanks, Linda. Thanks, Anne-Marie. Thanks, Helen. And
Thank you,
Tracy
Marva.
and Allison.
Thank you, Linda.
Wonderful. This is great.
Merry
Thank you
Christmas.
for having me.